a bacterial disease transmitted by sexual intercourse. It's a rare sexually transmitted disease since it isn't common in the United States due to this disease is primarily found in developing countries and it's also more found in men than women. Chancroid is also a risk factor for contracting HIV since the open sores on the genitals facilitate the transmission. The symptoms of chancroid show up within the 1 to 14 days after being infected. The person will get a bump in the genitals. The small bump becomes an ulcer after the bump appears. The ulcer ranges from 1/8 inch to 2 inches across, is painful, soft, has a base covered with yellowish or grayish material and if scraped it would bleed. The ulcers have specific locations for the men and women and each one have a certain amount too. Ulcers in women: inner vaginal lips, outer vaginal lips, perineal area, inner thighs. Ulcers in men: prepuce area, grove behind the head of the penis, shaft of the penis, head of the penis, scrotum. Men tend to only have one ulcers, meanwhile women have about 4 or more. The transmission of chancroid occurs during unprotected sexual intercourse. The only absolute way to prevent chancroid is by avoiding all sort of sexual activities. However, if that's not possible, safe sex behaviors may reduce the person's risks to admitting it. Safe sex behaviors like the proper use of condoms from the beginning to the end of each sexual activity can decrease the chance of catching it. Only a healthcare provider can diagnose chancroid by examining the discharge of the sore with a microscope, and that's the best method of diagnosis since it's often confused with other infections like herpes and syphilis. When chancroid occurs, it's treated with antibiotics and the large lymph node swellings are to be drained by needle or local surgery. There aren't reports of adverse effects from chancroid on infants, but since the effects of Zithromax on pregnant women has not been adequately studied, the drug it's typically not recommended when a woman is pregnant. Please subscribe to our channel and give this video a thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.